But I'm saying, really, this would have been a great idea Monday, right? When people probably had time to call 311 and anyway, so I hope they figure that out. It's 7:23. Let's go into the KUAM News Zoom room where Chima Mbakwem is standing by. Happy first day of school, Chima.
Thank you, Chris.
Right on. Good morning, and thanks for joining us. He is the Chief Public Health Officer, fresh off that press conference yesterday. Let's just kind of go over that, Chima. So we've sent a bunch of samples to the CDC, and the latest batch that we sent out came back, and there were, I believe, 5 Delta variant cases with no known travel history.
Yes, one had a travel history. Just one.
This one. So 4 with no travel history.
And to put it correctly, these samples were collected from June to July, but they were sent out on July. They were sent out in, I think, July, to be exact. I just want to make sure that, I give out the correct dates.
Yes.
Because, they were sent out on July 26th to CDC for genome sequencing. So the batch that was sent out was from June to July. And then we received the results yesterday, which was the 11th. Out of the 21 samples that were shipped, 18 of them had variants of concern. 13 of them were the Alpha variant, and then 5 were Delta. And out of that 5 Delta, 4 were no travel history, and 1 had a travel history.
Right. So, Chima, I guess the first question is, based on those results and given the time that those samples were taken and sent off and when you got them back, is it you guys' assumption that this surge that we're seeing the last couple of weeks is related to the spread of the Delta variant?
We can't say exactly, because we also have the other variant of concern, which is the UK variant, which is also a quick spreader too. But having those two at the same time actually points to the fact that the current situation can be attributed to the fact that we have the Delta variant, which is almost 6 times more infectious than the other variants, and then also having the same ongoing transmission of the other variant.
There was also a great deal of information you had spoke about the contact tracing relative to some of these surge cases, right? So let me get this right. There were 3 events that were involved with this spread and this surge that we're seeing now?
Yes. So the first one was the cases from the 23rd of July, where we had 5 cases. These were individuals that visited a bar, and we were able to identify 5 people from that setting. And then the other one was a wedding reception. This is the big one.
Yeah.
This is where you had almost approximately 300 people who were in that place, and a total of 18 of them actually turned positive. But the interesting thing is that this is a super spreader event, and that's what the public health and the governor has been talking about. We're looking at large gatherings and what can happen in large gatherings. So you're seeing people from different families, you're seeing people from different walks of life congregating in the same place, and this is a huge super spreader event.
Right.
Even if the hotel has policies in place, what we really worry about is what happens before and after, and still at the same time in the event. So out of those 18, 7 of them came from 7 different households. So that is showing you how it's clearly expanding. And 7 of them were fully vaccinated, 6 were unvaccinated, and 5 of them were ineligible. But out of this 18, 15 of them actually went to another function where we discovered that 18 people from that function, 21 people at that function turned positive. So if you take out the 15 from the first, from the wedding reception, then you're going to see that we had 6 people that were positive from the party after the wedding, and 6 of these individuals were unvaccinated. So you're seeing how it is growing gradually, and this is one event that people will go back home, to their families, where we know that a lot of people are not using masks, and then these family members get exposed, and then they go out to their jobs, which will now become a secondary infection for people at their jobs. So, and then when they expose people at their jobs, these individuals will go home and expose their families. So this is just a series of events, contributing to the spread in the community. So this is just narrowing it down to 3 super spreader events that has actually contributed to what is going on now.
Chima, is it a karaoke bar?
Yes.
Okay. Is it the men's karaoke bar? Is that the one?
Yeah, that's what I have in front of me, yes.
Okay. And so I understand that during the course of the contact tracing, they were not cooperating with the public health investigators?
Yes, multiple attempts were made to obtain contact tracing list, but we couldn't reach them. It was difficult getting that list. And that was part of what the governor said yesterday. It is mandated that every restaurant should have a sign-in list. And what that does is that it helps public health to identify those who were there at that point, and were able to reach out to them. Most times, these individuals do not know who is next to them, but that list will actually help us reach out to these individuals to tell them that they've been potentially exposed to COVID, and we ask them to come in to get tested.
How frustrating is that when you get these, what was the reason that they just didn't want to help with the investigation, or they thought COVID was a lie?
You see, it's funny because the human beings are most times is about denial, is about maybe people didn't say where they were going to, and they don't want people to, those things actually add up.
Yep, somebody was meeting their TACMAT at the karaoke bar, and that's why they didn't sign the contact tracing sheet, because if the other half found out they were there with the TACMAC, and then that's going to cause drama, and then the owner's going to get in trouble, because then everyone's going to know that you can't bring your TACMAC to that karaoke bar. That's what you're saying.
I didn't say that. I just said it's difficult to obtain information because people might be in the wrong place at the wrong time, or might forget they were in that place. It's a mixture of people not being open with information. So whatever their personal reasons are for not giving out those informations, we don't have privy to that. But the fact is that we find it very uncomfortable. I've been reaching out to my team, and they've been really frustrated, and it's just funny. And for this, actually 3 individuals actually contacted 311 to disclose that their family members were a possible link to someone in that bar. So this was some anonymous people that actually reached out to us to say, hey, we think we know people that have been in this place. So these are the kind of things where we really appreciate. When people give us information to support what we're doing in the community, when people are not coming forward with information.
Okay. Well, I'm glad they're able to get through to 311. Guys, I just got a text from Crystal, Pago San Augustine. Due to the current programming of the 311 hotline, option 8 will not go live until 8 a.m. Again, I just go back to the planning. School starts at 8:30, guys. But, at least it'll be up and running if you have any questions after the first day of school, which I'm pretty sure you might. Okay, but a day. Come on, guys. You need a calendar over there. They need a calendar. Hey, first day of school's coming. Anyway, back to you, Chima. So you're basically saying, people were there with their TACMAN. They don't want to disclose. And so that's why the family members are calling to snitch on these people. That's good. Way to go for their family. That's good. Way to do your part in the community. Seriously, Chima, so What's your gut feeling though, man? Because we've had double digit and high double digit cases for 2 weeks now. And I don't know the way. I'm not the expert here, but when I look at it, it kind of seems like it's probably the Delta, or you're saying it could also be the UK.
Yeah, so like I said, knowing that the Delta is here actually supports the fact that is a super spreader. We've started seeing a huge number of transmission going on in the community. So that means it is out there in the community. But the confirmation will still have to come from the genome sequencing. So I wouldn't want to make the assumption, that is not out there. It's out there, but there are other variants that are out there too. But the key is people getting vaccinated, people wearing their mask, and reducing transmission in the community. If you're looking at the double digits that we're seeing now, it's actually a multiplier effect from these super spreader events that are going on and people going back to their families to infect them. But what we've been able to do is that within these 2 weeks, we've actually increased active case finding. We have testing clinics going on in the community so that people would go out to at least know their status. And the good thing is, when you go out there and test and you're negative, it is a point in time test. What it tells you is that at that point, you don't have COVID. And then if you're vaccinated and you're wearing your mask and you're watching your distance and washing your hands and following all those public health and social interventions that we recommend, that means you're protecting yourself. You're personally responsible for your own safety. So that way, if every individual adheres to this and continue to do this, then we're going to go back to 0 or less than 1 digit, which is understandable because we're still in the pandemic. But the increase in numbers can actually be attributed to the Delta variant that we just discovered. There's been a lot of speculations. We're looking at our cases recently, as it was increasing, we were hoping, working very hard to drive down the trend. But at the same time, all of us had that gut feeling that it could be Delta. Yeah. And I think on Tuesday night, or was it Wednesday night, it was off and on conversation between myself and the director of public health. And he kept saying, we need to gear up, we need to continuously move on. I think, with what I'm seeing, it doesn't seem good, but I know your team is out there, they're working hard. He continued to encourage us. And lo and behold, we walked into the office yesterday, and the first email we get is the Delta variant. And I just walked into his office and I said, you said it last night and it's here. But the fact that we started on time, to do active case finding and ensure that we isolate those who have been exposed, and at the same time encouraging the community to come out, because we really don't know what is going on in the community now, and the only thing that can tell us is the active case finding that we are currently doing now, and it is showing that there's something going on from 15, 10, 12 cases to 40 cases, 50 cases shows clearly that there's something going on.
Yeah, for sure. Break.
I just wanted to follow up on the wedding you mentioned. That was on the 23rd at the Doucet.
Yeah, when were the restrictions lifted?
I think the 28th, right?
Yeah.
But the wedding was on the 23rd. Is that what you said, Chima?
What I have here is the 24th.
Okay. And the samples for the Delta variant were from June to July 25th? 26. Were any of the samples, virus samples from that wedding that returned positive for the Delta variant?
Yes, it's too early to make that call because what we're doing now is going back to look at the particular samples that were detected. Those particular samples. Then we're going to now look back at who the individual was. Who their contacts were. So it takes some time, but is doable, but it takes some level of work to
Right.
get that.
Chima?
But it could be possible that one of the samples that
Yeah,
were
it could-
sent could
yeah,
have
it
been
could
from
be.
that wedding.
Right,
And
Chima, though, is it?
And Bree, that's the concern,
Yeah.
these super spreader events.
Mm.
It takes one person, with Delta variant, not wearing the mask, and every individual around them not following the public health recommendations, and boom, the community is going to be lit up.
Yeah, Chima,
So,
so the COVID 1.0 infects what, 2 to 3 people, and then the Delta, is it 4 to 6? Is that the data?
Almost 5 to 6, yes.
5 to 6. I wanted to ask though, so this wedding at the Dusitani on July what?
24th.
What I have here is the report was on July 24th.
Right, and so we didn't achieve herd immunity until July 29, I believe. And so what type of restrictions were in place at that point that would have affected this wedding that had 300 people?
Chris, when you're looking at 75% capacity
I
of
see.
of an area, it is about size.
Right.
So you can have 400 people in
I got
one.
you. So it wasn't
Yeah,
100.
so-
At that time, we weren't like limited to 100 people.
Yeah, but we were up to 75%. So
I
you're
see.
going to look at the capacity of the venue.
So when you looked at it, it was all up on the up and up?
Right. This is in retrospect, because the thing is that we're able to identify, where it started, and we're able to get all those positive cases from that wedding. And I think the cases were confirmed between the 31st and August 11th. All the 18 cases.
So, Chima, I mean, the last few nights, I've been having anxiety waiting for these JIC results to come out and praying that it's going to be like 7 positives. But, my prayers aren't being answered right now, and I did it again last night, and then we had 48. So what are you tracking for today's results? Are we anywhere near the end of this surge?
Remember the last time I was here with you, I said it's going to be next week. Next week is going to be the icebreaker for us, because what we're seeing now is that we have increased case finding in the community. So people are actually coming out to get tested. People are getting isolated. People are getting quarantined. And then we are encouraging people to continue following public health recommendations. So if all these are in place and people start adhering to it, with the base wearing their mask, with us doing more active case finding in the community, with us putting out more messaging, asking people to get vaccinated, we are going to see a downward trend, in the next few days. That is my anticipation, my hope, and I'm optimistic that people are going to listen more this time, because the fact that we have the Delta variant here should be a lesson to everyone, to know that if you were able to infect one family member, you're going to infect all your family members right now, because the home is where we are at our lowest, where we are less on guard. So, but the recommendation is wear mask, indoors now. So outdoor, indoor, vaccinated, unvaccinated, you should, continue the correct and consistent use of the face covering.
Right.
And
That's what we're going with now, is right, as we want to kind of reiterate, go back to basics, or else there's going to be restrictions.
Yeah, that'll be a tough one. But if it's the option on the table, we wouldn't want people getting infected and people getting sick. But I think that is not the first option on the table. The first option on the table is go get vaccinated, wear your mask, wash your hands, follow the public health recommendations. We really don't anticipate, and we hope that it won't get to the point where we're going to shut down the island again.
I wanted to follow up on some of the questions that Nestor was asking yesterday regarding the COVID alert app. Can you let's just start from the beginning because it's been a while since we've actually talked about this. How does this work? Or how is it supposed to work?
I clearly missed Nestor's question. I clearly missed it, and I hope he understands. There was a lot going on yesterday, and I was just trying to, while at the press conference, I was still trying to figure out how to put out this fire. So the COVID alert is actually designed to alert people who have been close to someone who has tested positive for COVID. But for that to happen, that individual would need to, first of all, download the COVID alert. So you need to have it. Then the other individual around you would also have the app, right? So how it works is I get tested, I get notified. I say where I was and what day and what time. Then the system actually alerts everyone who is around me at that time that they are potentially exposed to someone who has COVID. So what it does is that when it alerts you, then you can go get tested. So it actually helps before we get to you, the system, the app actually gets to you. But what we're seeing is that a lot of people are not doing that. So we still use the traditional public health case investigation methods to reach out.
So is it just the downloads are low, or people that had downloaded it just undownloaded it? I mean, how many people are actually on this COVID alert app?
I don't have that number in front of me, but a huge number of people have actually downloaded the COVID alert. But it actually lies on the person who is positive. Is that individual who has to start the process. If that individual does not start the process, the other individuals who were exposed to it will not be alerted.
Because it just didn't seem like it kind of helped in this situation.
I'm sorry, guys. I just want to apologize.
Because I thought that it's supposed to help with digital contact tracing.
Because I deleted that.
You guys still encouraging people to download this thing?
Yeah, definitely. Yeah, we do. Yeah, it's important. And with what is going on now, it clearly shows that it can help. When you're at a super spreader event, like anyone who has been at any of these places that have been mentioned, if you had the COVID alert and the individual who tested positive actually, complies, you're going to know it. But what we're doing, so I think that's what is unique about our island. When someone tests positive, it's easy for you to, identify who these individuals are because people are honest enough to say I'm positive in some instances, right? Family members will go get tested, they'll tell their friends to go get tested. And that is what we're seeing with the increased number of testing that is going on now. That will show you that people are actively going out to get tested. And I think it's important that at this time, everyone should at least know their present status. Know your COVID status today. That will help you moving forward. That will help you know that you're safe. That will make you know that your family is safe. Then when you continue your consistent and correct use of your mask and you're vaccinated, then your chances of getting infected is almost minimal. And then you infecting someone is also minimal. So I think it's a two-way thing that, you protect yourself and protect the community. That is the expectation.
I want to also talk about the vaccinations, because when I was looking at the numbers, especially for the vaccinations, because we're really trying to push people to go get fully vaccinated. But when you look at the first dose and you compare it, to the second dose, there's like thousands of people that haven't gone back to get that second dose. So what kind of words do you have for these individuals? And why wouldn't they go back to go get the
Maybe
second
they got
dose?
sick on the first dose.
Partial immunization does not translate to full immunization. That is just a simple way to do it. Your level of protection with the first dose will not be as high as your protection from the second dose. Even when you get the second dose, it has at least 2 weeks to kick in. So you have to complete this process. For J&J is 1 dose, 2 weeks, you're fully immunized. The fact that you get 1 dose, yes, you have some level of protection, but it is not the recommended level of protection that we want. We want you to be fully vaccinated so that you'll be fully protected. And remember, the vaccines have been holding up against the Delta variant. And it's obvious because if you look at our hospitalization rate, compare it to what was happening last year and when we didn't have the vaccine and what is going on now, there's a clear indication that the vaccine is actually working. So we're seeing very high transmission and very low hospitalization. But what we want is no hospitalization, low transmission. That is what we're supposed, where we're heading now. But we can only get there when more people are immunized, more people are testing to know their status, and then they are following the public health and social recommendations that are out there. We'll continue to be in a safe place. And there's no cure for COVID. So for a disease that has no cure, it's important for people to know that we need to continue protecting ourselves. So we should be on our guard, because the more transmission, the more chances of mutation for the virus. So today we're talking about the Delta variant. I'm also worried about someone who's going to be infected by 2 of these deadly variants. If you get the UK variant and you have the Delta variant, whatever is going to come out of it is what we're trying to avoid. So, because the more transmission, the more chances of mutation. The less transmission, the lower chances of mutation. So this is also a balance that we need to strike in the community.
Chima, in Hawaii yesterday, they started reimposing restrictions, 50% occupancy, restaurants, bars, churches, indoor gatherings limited to 10, outdoor gatherings limited to 25. Right now, so our messaging is to go back to the basics and do the 4 W's, right? Do you think that's going to be strong enough to put the lid on this surge? I'm very hopeful, you know. So we're looking at the. So first of all, we're looking at the pharmaceutical intervention, which is the vaccine, which actually is a layer of protection. Then we're looking at all those non-pharmaceuticals that we have in place. So what we're going to see next week is our test rates now will determine by next week what is going on in the community. That will determine what decisions or what recommendations public health will present to the government. That will determine what restrictions might be imposed or lifted, you know, but next week or next 2 weeks would actually show a lot. Because, okay, let's assume today we had 48 cases yesterday. This morning, people get immunized, you know, people start following public health restrictions. What will happen is that these mitigation measures will stop transmission in the community. If people continue following the public health recommendations from today, but the ones who were infected yesterday, they would have been exposed to their close contact, their workmates. If we identify them and put them in quarantine for the next 10 days, these individuals who are exposed are in isolation for the next 10 days. So that means in the next 10 days, we've seen everyone that has been exposed from yesterday going backwards completely out of isolation or quarantine. And then we're going to move forward without seeing any community transmission. That means we're good. But if we continue seeing new cases on the rise every day, what is showing is that more people are not following public health intervention. What it shows is that there is transmission going on in the community. What do you expect us to do? We will have to make recommendations on how to cut off that transmission. So that will bring in restrictions that are higher than what we're using now.
But what we're what we're trying to do is within this period, make sure we continue active case finding, make sure we encourage people to go get vaccinated. The clinics are out there, the mandates are there for people to go get vaccinated by businesses and employers. So when we see more number of people getting vaccinated, more active case finding and low numbers, then that's clear. We're in the clear. We're good. But if we do this and the numbers continuously go up, then we will be forced to make recommendations.
Chima, we had Dr. Wynn on the other day, and we asked him about when do restrictions kick back in, and he said that the trigger was 10 hospitalizations. Is that the case? I mean, because at what point do we get even more serious?
Okay, so if you're looking at if we're using that as at last year, so what you're going to look at is how many people were hospitalized. Why were they hospitalized? Right now, you're going to look at how many people are in the ICU, how many people are on ventilator. So if you look at this, you're going to find out that the people in the clinics right now do not have severe life-threatening conditions. So we've not gotten to the stage where we were last year, where we had multiple people on vents, multiple people in ICU. But what the doctors are saying is people delayed treatment, because of COVID. So you're having people with more severe or acute illnesses that they also need to treat. They're also putting that into consideration. So it's just not COVID. It's also about other illnesses, other conditions that they are facing. So that's why the doctors on their own are saying, please be careful, follow public health recommendation. Yes, we're doing good now. We don't have that level of ICU beds that are taken up. We don't have high number of people in vents, but they're saying we don't want anybody with COVID in the hospital. They don't want that. So that's why they're saying if you adhere to public health recommendation, you won't be in the hospital. So that's what it is. So that number last year was more severe, but this year is not as severe as it was.
I wanted to follow up on one of the questions here. Here it is. This is from one of our online viewers. Knowing the spread is not under control yet, why wait for 10 hospital COVID admissions to put restrictions back in place? I mean, what?
Yeah, it's a fair question.
And again, what is the trigger where we put restrictions back in place, other than wear your mask or you're going to get ticketed and whatever it is, fined, and back to basics.
We need to bring back
Kiko the Carabao.
Like I explained, what it was last year is not what it is today. We have some level of respite. We have the vaccine. We have lower hospitalization, severe hospitalization. So we can't just institute restrictions without taking this into consideration. But that is also being monitored, because I think last we went from three hospitalization to 8, but people are being discharged. But they are still monitoring what the hospitalization rates are. But that would also determine. That would also be in conjunction with what public health recommendations are. So it's just not one side taking a decision. There are so many factors that we're going to put into consideration before we increase restrictions. And like the governor said, if it gets to that, she will do it. So it's clear. So it's not. If it happens, it shouldn't come as a surprise. But the fact that we are not doing it is that there is a lot of confidence in what we're doing right now. And we believe that the community would adhere to those recommendations from public health, and then, like I said, next week would show us a clearer picture of what is going on.
All right.
what point do we look at the quarantine and the incoming travel procedures, Chima? Because we had so many people traveling. You know, they go to the States, they party with no mask, and then they come back with that negative test, right?
Yes.
But we know just from all these conversations we've had with you and your colleagues that a negative test doesn't necessarily mean that you're not going to have COVID the next day or whatever.
Yes. So the travel test is to do one thing, is to make sure that you don't get on the aircraft or embark on that trip with an active disease. So what it does is that it actually weeds completely out everyone who has an active disease. But when you arrive to your destination, there are public health recommendations that you need to follow to continue being safe and continue keeping the community safe. So you get on the plane with a negative test result or you're fully vaccinated, you land on Guam, you continue to wear your mask, you continue to watch your distance, then we're safe. But the challenge is, if you get on the plane, come to Guam, and then you don't wear your mask, then that is where the problem will come from if for any reason you get infected. So it is a balance of making sure that people who are coming here at the point of embarking on that trip, they don't have an active disease. And then if they land here, we have public health recommendations in place to continue keeping us safe. And like I've always said, is a layered approach. So one cannot act independent of the other. So you need to follow everything that is listed in that layered approach for us to be continuously safe. So you can't take one against the other. If you have a negative test, you arrive on Guam, you continue to wear your mask, wash your hands, keep your distance, and then when you arrive on Guam, we encourage you to get vaccinated. You know, we're allowing people to come here to get vaccinated. It's out there. And then people should also encourage their visitors, you know, to get vaccinated. You know, family members traveling off island, you know, coming to visit should all get vaccinated. And one thing is that for those of us who are locals, who are traveling to these places that have high cases of transmission, should please be aware that even if they don't have any mask mandate in those places, you wearing a mask would keep you safe. You wearing a mask will keep us safe, because if you wear a mask out there and protect yourself, you're coming back to the island without COVID. But if you go out there and do what they are doing out there and get exposed and then get on the plane and come back, being immunized does not mean that you can't get infected. So we're seeing a lot of people who travel this period, going out there, behaving like the people out there, and then coming back here and, you know, being infected and not even knowing it, you know. But I've seen a couple of people, you know, I've spoken to a couple of my friends who went out there, who got exposed, and good enough, they got tested, you know, and they know their status. And I think that is key too, because when you come back from these trips, knowing that you've been to high transmission areas, it's also always good to know your status, you know, as you integrate into the community. It's going to save your family first, because you're going to go out to these high transmission areas, come home to your elderly family members or people with underlying conditions and expose them to COVID. Because if you're fully vaccinated, you might be infected, you might not have symptoms, but the fact that you can transmit the virus is also there. So it's just to understand these dynamics. You know, there's still danger out there, but following public health recommendations would actually limit, you know, your chances of transmitting the virus or getting infected. So that's the balance. That's how I'm trying to message it out.
Thank you, Chima.
All right, thanks, Chima.
Okay, appreciate it.
Thank you so much.
Chief Public Officer for the Territory of Guam, that is Chima Mbakwem, with some very stern words for those traveling abroad. It is 8:02 KUAM TV. Here we come.